Hey, how's it going, guys? Saman here from All Things PT. In this video, I'm going to go over some exercises that could potentially help you with your knee pain. Now, why did I say potentially, like I'm not confident in these exercises? The reason is very simple. The knee pain is such a broad topic that covering exercises for every different condition is almost impossible. It's going to be like 6+ hour long video, and I do not have time for that. So this video is not for individuals whose knee pain is because of some kind of trauma or traumatic in nature. What do I mean by that? You are involved in a motor vehicle accident, you got tackled on the sports, maybe you had a fall. Anything where trauma is involved, what I would recommend is go to your primary care physician, go to the ER, get an x-ray, get an MRI, get some kind of imaging done to rule out any kind of muscle tear, meniscus tear, stuff like that before you actually go to a physical therapist to get an exercise that is tailored for you. This video is for individuals who has a knee pain that is insidious in nature. So basically, maybe you squatted too heavy at the gym, maybe you overtrained, maybe you ran too much too soon, stuff like that, where the knee pain probably started with maybe say 1 or 2 out of 10 pain, 0 being no pain, 10 is the worst pain. And then gradually with time, it got worse. And now it's a point where it's pretty inflamed, but there isn't one very specific trauma that you can point out. Okay, so that video is for you. Now, because I made this video for individuals that are experiencing a lot of pain, I have made this video very simple exercises, and I've also introduced a lot of isometric where you're actually contracting the muscle without moving the joint through the range of motion, because what studies have showed is isometric contraction, isometric exercises are what's best at the initial stages of your healing and recovery. So I've kind of mentioned this quite a few times in the video. I've also made sure that we don't need a whole lot of equipment to do these exercises, because if you're doing it at your home, you may not have access to a gym or whatever. If you have a gym, great, but if you don't, this video is still good for you. So let's move on. So here's what I believe is one of the most underrated exercise for any kind of knee pain, and it is a backward walking. We as human beings tend to always walk forward, well, most of the time, right? But then we don't really walk back. And so I have kind of tried this with a ton of patients, different age groups. When I have them walk backwards, no matter the knee condition, the knee pain improves significantly. And I don't really see, even though it's kind of getting traction these days, I don't really see a whole lot of physical therapists prescribing backward walking for whatever reason, and that really helps. So you can start off without any incline, and then as you get better, you can start adding incline. And so I started on a flat, and now I am at a 4% incline. Okay, and you can kind of keep going, increasing your incline as you get better. You can obviously hold on to the side, the hand support at the beginning, but as you get better, you can always let go of this and walk. And this, I feel like it's relatively easy to perform. You can do it anywhere. It may look weird a little bit, but you can do it anywhere. And this really solves a lot of knee pain. And this is also an excellent warm-up for all the other exercises I'm about to do. But this is a really good start. This directly focuses on that knee, getting that knees over toes. As you get more and more higher on the incline, your knees will go more and more over toes, which we know a lot of people feel like it's not good, but you know, your body is meant to bend, right? So start off with that, 3 to 5 minutes, and then we'll move on to something else. Okay, before I forget and move on, what I want to point out is this is not something you do super fast. I had the speed of 1 mile per hour throughout, and that's where I recommend most people to stick at. You can kind of play around as you get a little better, but I would rather increase the incline up first before I even increase the speed, okay? So please keep that in mind, because I don't want any one of you guys to fall or injure yourself in any way, all right? Let's move on. Okay, so the second exercise I would do is for my hip mobility. Now you have to understand that the knee is a middle joint between the ankle and the hip. So any discrepancies that you have, any imbalance that you have, any restrictions that you have in the hip and your ankle is going to show up on the knee, causing those pesky knee pains. So we gotta make sure our hip is mobile and strong, and then our ankle is mobile and strong. So we're gonna start off with my favorite hip mobility exercise, and it is a 90-90. So all you're gonna do, you're going to go like this. So what happens with that is one hip is internally rotated. So in this case, my left hip is internally rotated and my right hip is externally rotated. So you can just be in that position for a little bit. And what I notice is that my left is a little tighter in this position, in internally rotated position. So I need to spend a little bit more time in this position, okay? So you can be here. You can also move a little bit, just whatever you can, and then switch. Okay, so like I said, this hip doesn't feel as tight compared to the left. And you're just gonna move. Nothing should be pinching or hurting. And then as it gets better, try to maintain your posture with the best of your ability. And then keep moving. As you keep doing repetitions, you will notice that it's getting a little bit better. Okay. All right, so I would do that for about 10 to 15 reps each side, and it really helps to open up that hip. The next one that I feel like it's a lot of problem for a lot of individuals with knee pain is your tight hip flexor muscles, okay, especially the iliopsoas muscle. And what I like to do for that, so first of all, you know, everyone has seen this stretch, all right? And so a lot of people do this stretch for the hip flexors, which is great, but a lot of people do it incorrectly. What I see in the gym, I don't really go to the gym a whole lot these days because, you know, I have my own gym, but when I used to go to the gym, a lot of people would do something like this where they're arching the back, and it's just not really good for the back. You may loosen up your hip flexors, but then start having the back issues, right? So what's the point? So the correct way to do that first is make sure you're tilting your pelvis. So this, if I were to tilt my pelvis forward like this, it's called an anterior pelvic tilt. And if I were to tilt my pelvis back in that direction, like I'm tucking in the tail, is called a posterior pelvic tilt. And you gotta maintain that posterior pelvic tilt. And as soon as you do that, you are gonna notice you're already feeling a stretch right here on your hip flexor without even doing much, right? So if I were to let my pelvis go and arch my back, I don't feel a stretch. Without even doing anything, I tilt my pelvis back like this, posterior pelvic tilt, and then I notice I'm already feeling a stretch. So now the goal is to keep that position right there, okay? What we are going to do next is we're going to squeeze this butt as hard as you can. And that again, after you do the posterior pelvic tilt, after you squeeze the butt, you can feel a lot of stretch right here without even doing, again, anything. And after that, if you want, you're going to lean slightly forward. Woo-hoo. See, I don't even have to bend so much forward if I were to keep my proper hip line bend and protect my back. So I would stay here for about, I would say 30 seconds or so before I switch, and I can definitely feel the stretch. So tight this butt, posteriorly pelvic tilt, keep it right there, squeeze the butt, and then move forward. And in this case, I felt a lot more stretch on the right. So these are the discrepancies that you guys gotta keep in mind, so that, okay, for the internal rotation, my left hip was limited. For this hip flexors, my right hip was tight. and then kind of compare. So once you are kind of a little used to this stretch, you can do this in this position where your knee isn't really touching the ground. And this is where you got to be careful, because a lot of people will do this where they'll put the knee too much forward. And like I mentioned in the video earlier, the knee over toes are not necessarily bad, but a lot of people, when they do it, they will experience pain. And the goal is to get to that knees over toes position, but you don't want to do it right away, okay? Sorry, I got a call. So what you want to do, so same thing, I personally like to make sure that I am give or take 90 degrees right here, my front leg. And my back leg, I try to get it straight, but I am tight. So it's something that I'm working on as well. So what I do is I keep that position, keep this front leg super sturdy, like get my quads, try to expand the quads, try to expand the hamstrings, try to make this whole thigh as big as possible, keep it right there. And then I do the posterior pelvic tilt, squeeze my butt, and just be in that position. I don't even need to go any more forward on this. It is absolutely fine. And when you do this exercise in this fashion, there are two things that are happening. My front leg, I'm isometrically working my quads, isometrically working my hamstrings, and I'm stretching on the other side. So do that 30 seconds to a minute. It might be very hard to get there at the beginning, but that's okay. And then you stretch, and this is how it's going to look from behind, about 90 degrees. Get a bend, tilt your pelvis best as you can, squeeze your butt as best as you can. Hold that for a minute or so. I think these two, the hip 90-90, the hip flexor stretch, especially once you get up, I think these are two great warm-ups that you can do before you move on to the others. But before we do other exercises, I think it's important to work on the other aspect, which is our ankle mobility. And if you can sit like this, or if you can't sit like this, first of all, if you can sit like this, the best of your ability, or even if you have to kind of roll or hunch back a little bit, in this case, it's kind of okay as long as it's not causing any back pain or anything. Just try into getting a habit of this position. And I just roll side to side, and that really helps with opening up that ankle, okay? So side to side. If you cannot, for whatever reason, then you can just be in a half kneeling position like this, okay? And then you can just focus it one knee at a time, or I should say one ankle at a time. And so if you can see here, now my knees are over my toes. And so that may be painful for some people, even though it's not fully loaded, because you're not putting full body weight on this position. Even if this is not fully loaded, it may cause some pain. For me, it didn't. For some of you, it may. Do both sides and be in a position that's comfortable, right? This is to relieve knee pain. So I'm in this position again. If this is uncomfortable, I can be like this, you know, whatever works. Now, if this position is just out of the question, what you could do is, give me 1 second, pull out a bench, okay? So we're gonna need this for our another exercise. I'm gonna keep it here. But you are going to keep this bench just like this. And you're going to do the same thing where you are just kind of putting on the bench, and you're doing this. Just rock back and forth. Make sure the heel doesn't come off the bench. So, because this, if you were doing something like this, then this is kind of useless, right? And so this position for a lot of people is much more doable than the previous one. So pick what works for you. Alrighty? Okay. Now let's move on to the other one. So like I said before, any deficits on the ankle and your hip is going to show up and it's going to cause knee pain. So previously we did hip and ankle mobility, and now let's move on to hip and ankle strengthening exercise. And to do that, all you need is a floor or a bench. One of my favorite exercise when it comes to strengthening the hip, especially if you're a beginner, is what you call a bridge. So all you'll do, and I like to put my feet on the bench like I'm about to show you, because I feel like that takes a lot of knee pain out and isolate your butt muscle. So you're going to be on your back like this, and all you're going to do is you are going to squeeze the butt and lift your body up like this. And in this position, you are going to squeeze and hold that position for about 10-15 seconds. Now remember, you don't want to arch your back like this, so we're doing that posterior pelvic tilt on this one too. So it may look like I'm rounding my back, but that actually, this is not a loaded position, right? When you're doing a squat, you don't want to do it like this, but if you were to round your back just a little bit, not round your back, but tilt your pelvis posteriorly, it really will help to activate that glute. Hold for about 15-20 seconds. I think it's more than that already, and lower. So again, tilt your pelvis back, hold for 15-20 seconds. Make sure your back is not into play, and down. So if you notice, this is at a 90-90 position, okay? So this will help to isolate the glutes a lot more. Now, the same exercise can be turned into more of a hamstring dominant exercise. So two reasons why I did this. A, it takes stress out of my knees, because a lot of people with knee pain, when you bend the knee and do it on the ground like this, it hurts the knee. So doing it on a bench takes that pressure off and puts all the stress on the butt is what we want. But if you want to turn this into a hamstring exercise, you just go back, dig your heels on the bench, on the couch, like this, and then instead of using your butt, you can pull with your hamstrings and lift. You can always do a posterior pelvic tilt if your back is giving you problems, but try it and try to do a anterior pelvic tilt while you're in this position if you can, and do a posterior pelvic tilt. So try to do it with your hip turning this way and then that way. See which one is effective, and you will quickly realize that when you are turning your hip posteriorly or rounding your butt a little bit, you are going to feel a lot more activation of your hamstring, a lot more activation of your glute. In this case, even for me, my hamstring is on fire. So you're going to hold it isometrically and down, okay? And again, so posterior, dig your heels down on the bench and really hold. Just like that, 20 seconds. So here is why I wanted to initiate this movement instead of doing like 15-20 repetition with the isometric. Is isometric movements are a lot friendly on the joints compared to your regular 10-20 repetition. So isometric holds teaches the muscle how to contract properly, teaches you how to feel those muscles, and it takes the stress away from the joints. And during the flare-ups that you're having while you are at the beginner part of your exercise rehabilitation, I think isometric is a really good tool to strengthen the muscles, to get a feel of how the muscles contracting, stuff like that, without really flaring up. But you gotta hold for about 15-20 seconds. You are in charge, so if 15-20 seconds is too much, just hold for like 5 seconds. And I would do like, do like 4 or 5 repetitions of that initially until you build up the tolerance, get that muscular cue of contracting those muscles, and then you can increase your repetition and decrease the hold times. But again, isometric is a really, really good starting point for a lot of people. So this is a great hip exercise that you can do. The next exercise we're going to do is going to target this muscle called a gluteus medius. It's a super important muscle because it's a stabilizer of the hip. It's the muscle right there in the side, and so the goal the muscle, the function of the muscle, there are so many functions, but the main function of the muscle is when you are taking a step like this, the only reason, one of the reasons why the hip doesn't drop like this is because that gluteus medius comes into action and it'll kind of stabilize the hip. Up until now, I would say good 90% of individuals that come in the clinic with hip pain, back pain, knee pain, ankle pain, their gluteus medius is weak. And so when it doesn't do its job of balancing your hip as you're walking, then every time you take a step, the knee will have a little bit of a cave-in internal pressure like this. You do that 10 times, nothing's gonna happen, but you walk 10,000 steps a day, and then you are having this internal force come in every single time, it's going to hurt, right? So you need these bands for that. I have like a bunch of these from Amazon, different difficulty. And so there are a lot of ways to target these glute med, but this is by far one of my favorite, not because it's the best, but because it's so accessible, everybody can do it, and everybody can notice immediate results. So all you do is tie the band right on top of the knee like this. You can put your feet shoulder width apart, and you are holding this position for about 30 seconds to a minute. It may not feel anything at the beginning, like it didn't feel anything while I was kind of starting to show you, but now I can really feel my glute med firing. Once you are here and you really start feeling fatigue, what I like to tell patients is just give it a little bit of a nudges like that. Very, I can really feel those muscles kicking in action. The goal is to do it for about 30 seconds or so, but you can start with 15-20 seconds and relax. Now it needs to be challenging. You should really feel this muscle kind of burning in a really good way. Once you can do that, 30 seconds, once you can do that, you can work up to a minute, but after a minute, there's only so many bands you can add. So what I like to do instead is do the next exercise as a progression. Now is the time for my favorite exercise for the knee pain. It has helped so many patients for any kind of knee pain, to be honest. And that's something you kind of may have to work up to, but it's okay. You can do the previous one like I was showing. So next one is just the isometric squat. Believe it or not, it is so powerful, and it helps so many people with knee pain. So the goal is to keep it at the position at about 90-90, and you are going to have this in a shoulder width apart. The key to remember is you're going to squeeze your thighs and your hamstrings, squeeze your thighs and your hamstrings together, keep that contraction, and you are going to hold for about 30 seconds or so. You can obviously add resistance on this as you're holding, but here is what makes this exercise so special. So once you can hold that exercise for 30 seconds, you're going to get that band you originally used. You're going to put it on top of the knee, and then you're going to do the same position, but this time squeeze the quad, squeeze the hamstring, make your legs as big as possible, shoulder width apart in a comfortable position. Push the band outside now and hold for 30 seconds, and oh my God, it really works your lower body. I can feel burning in my butt already, my thighs are burning, my hamstrings are burning. And hold that position for about 30 seconds or so and relax. I don't think that was 30 seconds, but you get the point. Here is the idea. You can do about 100,000 exercises and then some for your knee pain. You can do your squats, you can do your deadlifts, you can do your single leg stuff. You can do a whole lot of that. But I'm giving you the exercises that are simple, exercises that people without a home gym, people without an access to the gym can do it. And these exercises are relatively simple, right? If I were to give you guys squats and deadlifts and single leg stuff, there's a big learning curve on that. And although those exercises are probably much more effective than this, as long as you dose them correctly, because if you don't dose them, these exercises itself will cause injury. But if you dose them correctly, those exercises are probably a little bit better. But these exercises are great exercises to do at the beginning when you're having flare-ups, when you don't have access to the equipment, when you don't know the exact exercises to do. So those are a great start. Again, isometrics are a great place to start. If you're a beginner during flare-ups, it really works those muscles without pissing those joints. Okay. The final exercise of this for the knee pain is going to be one for the anterior tibialis. Everybody works the calves out, but not many people works the anterior tibialis. This is a muscle right here that helps to prevent a lot of ankle injuries as well as the knee injury. And this is one muscle that also doesn't really get worked out by pretty much anyone, even people that consistently train legs. So all you're going to do, lean against the wall, and you're going to lift your toes like this and down, lift your toes like this, and you can obviously hold on to the position. And this is what I want you to remember real quick. I just did it, just this exercise on the floor without shoes, and got quite uncomfortable on the heels, right? So I'm getting myself a pad so that I can rest it a little bit. So what you need to do, be safe, so make sure you don't slip, or you can put on your shoes. And what you could do, step on like this, raise your heels, raise your toes, hold for, like I said, 15-20 seconds. Your goal is to get to 30 and then down. Again, up, 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 up. Here's the thing with these, right? So the closer your heels are to the wall, in this case the squat rack, the easier it's going to be. As you get better, you can put this a little further, and then it becomes more challenging. You can do that for reps, but I keep saying, when you're having flare-ups, I think doing it for longer repetitions are a little bit more taxing on the joints, so do it isometric. Okay. Now, these are very simple yet very, very effective exercise, okay? Here's the key. There are about 1,000 plus some more exercises that you can obviously do. You can do squats, deadlifts, single leg stuff. Sure, these are very effective, but during flare-ups, these can be very, very painful. What I've also noticed are these isometric exercises I just gave you are really good for anybody. These are good for my high-level athletes when they have flare-ups. These are good for your everyday mom and pop or weekend warriors. These are good starting point for pretty much every patient out there who has knee pain, and these are super effective, okay? Like I said, there are 1,000 different, 100,000 different exercises you could do, but these gave my patient results, and I'm hoping through this video you will have those results too. Hopefully this video helped. If it did, please make sure you click the like button. Please subscribe to my channel because more videos on physical therapy coming soon. Until then, take care. Bye-bye.